Hi, folks. So today is March 31st, and I want to talk about a few things. I want to talk about some changes we're going to put in operationally by the end of this week. I want to start with a little more explanation of where we are today and just to be super clear about where we are. Number one, if you leave campus for any reason, even for a medically necessary appointment, you need to self-quarantine in your apartment for 14 days. That means if you are in the common area on your way outdoors, you need to be wearing a mask. If you are outdoors, you don't need to wear the mask, but you can't be within 6 feet of anyone. You can't stop and have a conversation. Quarantining means staying away from other people. It's not about punishment. It is about protection and about keeping the virus out of our campus. We've had a number of questions about visitors and about family. We've had some creativity. Folks who have creatively found ways to take a walk with their family or have their family wanting to come and sit outside and maybe have a meal with them. That's not okay right now. We need to do everything we can to keep any outside germs, anything from the outside out of our campuses. This is, I love creativity. I love when you guys try to outsmart me in some way or outthink me in some way. Now's not the time for that. This is serious. This is the time for us to follow not just the letter of the law, but the spirit of the law. And the spirit of the law right now is keep us apart from everyone else who does not have to be on our campus. Every time we run the risk, every time somebody new comes into our campus, we run the risk of bringing the germ, we run the risk of bringing the virus on our campus. And that is what we want to avoid for you, for your health and safety, for your neighbors' health and safety, for our staff's health and safety. And I'll tell you two little stories. This video might be a little long, so you might want to settle in and get a drink. So tomorrow, I don't know if you can see this. This is my daughter Megan. She turns 23 tomorrow. She was born on the April 1st blizzard in 1997, and she is living in Spain now. She's teaching there, and she's in lockdown. And lockdown in Spain means she hasn't left her apartment in almost 3 weeks. And she says to me, "Mom, don't let it get that bad there." The way for it to not get that bad here is for us to not have positive cases on our campus. So we need to do everything we can to keep our campuses clean and healthy for as long as we possibly can. And I want you to understand that our team, our staff, are working at that 100% of their time, nonstop, 24/7. It only works if you do your part. And you doing your part means understand how important this is. Understand that there's no skirting the rules. Understand that it does mean you. Understand it does mean your family. We can't mess around with this. I have called and talked with every single one of my friends in this industry. Around the country, just trying to get input and advice from folks who are in geographic regions that might be a little more advanced than us. And the best bit of advice I got was from a CEO in the Washington State area who said, really, their independent living residents didn't take it seriously enough in the beginning, and now they have 5 positive cases in their independent side. We don't want that. Don't do that to yourself or to others. Don't take any risks right now. Just keep it tight and then make it tighter. Keep a 6-foot distance, physical distance between you and others. Keep a 6-foot physical distance between you and our staff. If you see our staff scooching together, remind them. If you see your friends scooching together, remind them too. We're going to be better and tougher and stronger about this because everything we can do to keep our communities free of the virus, we are going to do. even if that means you get a little mad, even if it means it's a little less fun, every little sacrifice we make right now will be worth it if it gets us one day further without having a positive COVID case in our communities. So to that end, we're going to make some changes operationally. By the end of the week, we are going to discontinue in-apartment housekeeping. And we're doing that for a variety of reasons. Number one is we want to limit the amount of time or any of the occasions where one of our staff members is in your personal apartment space. Number two, it's hard to keep 6-foot distance when we're cleaning your apartment if you are there. And number three, by not doing the in-apartment cleanings, it allows us to redeploy our housekeeping staff into other high-touch cleaning areas, common areas, and into other areas, other roles within the community so that we can have fewer staff on site. And that's our goal. Fewer people on site, fewer opportunities for anyone who has to live outside of these walls to bring any virus in. That's our whole goal. It is all about keeping you healthy and safe, and it only works if you do your part. So housekeeping will change by the end of this week. Groceries. We have spent the last couple of weeks really stocking up on what we have in our community and country stores. I think right now it's fair to say we have everything you need in there. We are going to discontinue the personal shopping in terms of going out and getting you your specific items. But please do continue to let us know items you want. When you do that, what we will do is try to source them through our purveyors or through some bulk shopping. And that we'll then take those and sell those items in the country store. So we'll kind of stock them in the country store or the community store. That allows us fewer people going out into the community and then bringing things back in. It allows us to try to use our regular purveyors who are already bringing items here. It allows us to reduce the risk, and that's what we're all about right now. Preparedness. A number of you have asked, what will we do if we have a positive case? And even though, I would emphasize we're doing everything we can to keep the virus out, math does suggest with the way community spread is growing in New Hampshire, the number of cases are growing, that we have to prepare ourselves for the fact that it may be an eventuality, but everything we can do to keep that from happening or delay that from happening is exactly what we want to be doing. If we did have a positive case, there is a process by which Department of Public Health would notify us. There would be, if this was a case on the independent side, there would be isolation, obviously, for the affected resident and their spouse, if that was the case. Most likely, the entire community would be in isolation for a period of time to allow us to do what they call contact tracing. So understanding who that person may have come in contact with over the course of the previous 14 days. And allow us to do additional deep cleaning of all common areas. So sort of a head-to-toe kind of cleaning to ensure that the common areas were as safe as humanly possible. At that point in time, we could continue to back off restrictions, but a positive case means less freedom. If the positive case is in the healthcare center, the good news there, the bad news is that it's in our healthcare center. The good news is that our nurses and nurses' aides are used to quarantine. They have a certain set of procedures that includes essentially that no one comes in and out other than nurses and nurses' aides. And that healthcare staff handles all of the duties, including housekeeping and food delivery. We will very likely by the end of this week go to what we call universal masking in the healthcare centers. That will mean that all of our healthcare staff will be masked for their entire shift. The reason we don't do that full campus-wide is that there is a global shortage of masks. We just don't have the product, and the product doesn't exist to be able to do that for everyone. We will start and continue to use the cloth masks for some of our staff that have to be in closer contact with either other residents or the residents or other staff. But the message really is that if we are 6 feet apart, you don't need to be masked. So we need to do everything we can to remember what 6 feet is. 6 feet is a tall man. So, lay a tall man down and stay in between those, or stay on the other side of his head and his feet. The idea of masking would be great if it existed. Right now, that amount of, and the ability to source that amount of masks doesn't exist for us. We're doing everything we can. We are fortunate and in better situation than many, many communities, but it's still not enough to deal with if we had an outbreak and if we have positive cases. So please understand that 6-foot rule, it's not a suggestion and it's not a joke. It's a rule, and it's for purpose. The other thing I'd like to say is, I know how hard this is. We've had people ask, like, why couldn't my family come and just walk on the campus with me, and we'll stay 6 feet apart, and we won't touch one another, and the reality is, we just can't take that risk. I got to tell you, I'm not even that nice as a mother. But if my kids were here, I would hug them. I would touch them. I'd be so drawn to that. And I know that's what you're going to have, the same challenges with your own family. It's not worth it right now. Right now, what we need to do is make the sacrifices for yourself, for your friends, for your neighbors, and for our staff. Our staff is coming in here every day. They are putting themselves at risk by being out, by having a job that is considered essential, to cook for you, to clean for you, to care for you. Our housekeepers, our dining staff, our healthcare staff, our front desk, our screeners, our maintenance staff, everyone in our admin side, they are 100% committed to keeping you healthy, safe, and strong. And you need to be doing the same thing for them. So make the sacrifices for now. I'm going to make an additional video today for our staff. And I'm going to make a third video today for your family. And I'm going to say the same thing. As much as you want to be around your family right now, we want to make sure you can be around your family when this is over. And for that to happen, you got to stay healthy. And for you to stay healthy, you have to make these sacrifices now. So I know you want to. I know it's hard. I know the adjustment is difficult. It will be more difficult when we tighten the circle more and more. But the control will leave our hands if and when we have a positive case. Because it really, at that point, we really have to rein things in as much as humanly possible. Don't let us get there. Do everything you can while we're doing everything we can to keep that from happening. And I'll end with this. I kind of stole this from one of my friends, but it's the truth. Every crisis has a beginning, a middle, and an end. And we're past the beginning, and this is going to be a while. It's going to be a slog, and it's not going to be fun. But we have one another. You have community. You are safe. Your needs will be met. And you have people to be around. And you have people to be around who love you and who are here for you. We will get through this. We will eventually get to the end. And when we get to the end, we'll have done that successfully because we all made the sacrifices we needed to. So be a part of that, commit to that, and make good choices. So we'll see you on the other side. Wash your hands, wash your hands, wash your hands. Keep 6 feet apart. Thank you.